Welcome back. The CDC is investigating cases of unexplained hepatitis in children. As many as 109 cases are under investigation, affecting 25 states, including Colorado. Almost all of the kids had to be hospitalized. 5 of them died. 9Health expert Dr. Payal Kohli joins us now. Good morning.
Hi, good morning.
So these cases are so severe, but first, for people who might not know, what is hepatitis?
So hepatitis, Natasha, is inflammation of the liver. The liver is an organ that, filters the blood. Most common causes of hepatitis, usually a viral infection. As you recall, we get hepatitis vaccines. So Hep A, B, and C are the most common causes. But, we can also get it from really anything that damages the liver. So if our immune system starts to attack our liver, that's called autoimmune hepatitis. If we take too much Tylenol or any medication, for example, that could damage the liver, that's called toxic hepatitis. So many different reasons people can have inflammation of the liver.
Yeah, and these cases so mysterious and severe that the CDC issued a health advisory for doctors to be on the lookout for this, to report cases. I mean, how serious is this?
This is really serious, and we're really worried because we don't exactly know what's going on here. So 94% of the kids got hospitalized, and about 10% of them ended up with liver transplants. And as you said, so far we've had 5 deaths, but that may actually be underreported. So kids are getting really sick with this. Now here in Colorado, we've had 4 cases. Of those 4 kids, thankfully, none of them died or needed a liver transplant. All of them are recovering. But we know that it's been here since December, and we're still trying to scratch our heads as to what's causing it.
Yeah, and how does this happen? Is there a link between COVID and hepatitis?
So some of the kids that got the hepatitis were not vaccinated for COVID, and that's really where that came out of. But as far as they can tell, it's not necessarily caused by the COVID virus. In fact, many of these kids were negative for COVID when they had hepatitis. Now, some of them had co-infection with COVID and a second virus called adenovirus. So the thing that's emerging as possibly a commonality, especially in those cases in Alabama, is that all 9 of those kids had an adenovirus infection. Now, an adenovirus is a virus that causes colds. Usually. Right. There is a type that can affect the stomach and cause inflammation in the intestines, but only in immunocompromised people would it cause hepatitis. So we're still not entirely sure if this is actually the cause, but that's what we're looking at more and more.
So what should parents be on the lookout for in terms of symptoms?
Because we don't know what's causing it, it's hard to prevent it. Right. It would present most likely like a GI bug. So your child is nauseated, they're vomiting, they may have a fever, they may be fatigued. But if it starts to look not like just a GI bug and more serious, like they're lethargic, they're not eating, their stool changes color and becomes clay colored, their skin becomes yellow, or their eyes, the whites of their eyes become yellow, that's all called jaundice. Those are very serious signs that the liver is not working.
Besides this, how common is hepatitis in children?
Not very common. Yeah. And that's why this is so concerning to us, because clearly something is going on causing this, and causing it in such a fulminant fashion, such a severe cases in our children. So we got to keep looking, and the most important piece of this is parents keeping their radar up.
Yeah. All right, Dr. Kohli, appreciate you coming on and talking about this.